Singapore's national health insurance will see higher premiums of up to 35% starting next April. The increase in MediShield Life will be spread out over the next 3 years and support enhanced coverage. The Health Ministry says the changes will better protect Singaporeans against major health episodes that lead to large bills. It will also enable people to afford new types of care. So let's take a look at the expanded coverage. Claim limits will increase for inpatient stays and day surgeries to fully cover 9 in 10 subsidized bills. For an intensive care unit stay, daily claim limits will more than double. And those who have exceptionally large bills can also claim more in a year, with the policy year limit increasing to 200,000 from 150,000. Now, for day surgeries, increases in claim limits can be as much as $1,000, depending on the procedure. It will cover common surgeries like removing a gallbladder or joint implants. Now, one doctor says this move to increase claim limits for day surgeries would help free up bed spaces, as it allows patients to opt for these day procedures without having to think about cost.
We would prefer for patients to go through a surgery and go home early for recovery, as opposed to stay for a long time in hospital to recover. The home environment is always best in terms of getting not just family support, but also the more familiar environment as well. And it also frees up hospital beds for more critical cases. But if your claim limits are not sufficient for that, patients will order opt to stay in hospitals just to go through the procedure, which is not a good thing to be doing.
There will also be increases in claim limits for various outpatient treatments. Of note, limits for kidney dialysis will go up from $1,100 per month to $1,750 per month. Home-based care and new treatments like those that target depression will also be included under MediShield Life. Well, coverage will be expanded to high-cost treatments that are clinically and cost-effective. This will include cell, tissue and gene therapy products that could cure cancers and serious diseases, as well as high-cost drugs for blood conditions and those with conditions since young. Well, to help manage the increase in MediShield Life premiums, the government will provide 4.1 billion Singapore dollars worth of support measures. Now, this includes $3.4 billion in MediSave top-ups and $700 million in premium subsidies over the next 3 years. MOH says these measures will more than offset the cumulative increase in additional premiums. Sabrina Ng reports.
Madam Cheng Soon Eng started kidney dialysis 5 years ago and was paying around $1,400 out of pocket for treatment at a private centre. But after making the switch to a non-profit organisation for dialysis, she spends around $80 a month after using MediShield and MediSave.
对于我们没有做工的人就很压力了。好，现在我就是减轻我的负担了咯。
Older Singaporeans, like Madam Cheng, will see larger increases in their premiums. To help cushion the impact, the Health Ministry will release $600 million of capital from the MediShield Life Fund. This is the first time monies have been released from the fund, which comprises premiums paid for by different age groups to support their current and future claim needs. Apart from capping premium increases at 35%, subsidy rates will be enhanced by 5 to 10 percentage points for lower and middle income individuals in older age groups. This is a sample of how much different age and income groups would have to pay in premiums by 2027. There will also be a series of MediSave top-ups across ages. Those in the pioneer generation will receive up to $300 more, while those born in 1973 or earlier will get $500 more as part of their one-time modular package bonus. Newborns will get $2,000 as part of their MediSave grant.
In the longer term, encourage people to stay as healthy as possible. So that's why we are investing very heavily, Healthier SG, Age Well SG, support the community so that we take responsibility to keep ourselves healthy. I think it is a comprehensive strategy, but we need to do everything in order to keep this healthcare costs intact.
The government will also launch a pilot program in late 2025 that allows those aged 40 and above to redeem discounts on their MediShield Life premiums through physical activity.